drugs that have been approved over the last couple of years. First off, carfilzomib, which is the second cousin to bortezomib. That was approved as a single agent, and then we've since found out that you can combine it with other drugs, lenalidomide and dexamethasone, earlier in the course of a relapsed patient, and it works reasonably well. And we've also found that to be the case with daratumumab, which was one of the first monoclonal antibodies which was available for the treatment of myeloma, just approved back in November. We now know that that drug can be combined with 2 other drugs earlier on in the treatment of a relapsed patient to provide significant benefit. So once these tools are available, smart researchers like these guys figure out how to combine these drugs in combination and provide them to a patient earlier on in the course of their disease so they can obtain a longer standing remission.
So why didn't you get on was right when you were at the Lilly, right? So, Dr. Silverman, can you comment on the drug elotuzumab and how does it work? And so may address some of the questions that have been raised by the public.
So, elotuzumab,
I think.
elotuzumab is a antibody drug. So it's, oh, there we go.
Now we go.
So it's a drug that is targeting a specific protein called SLAMF7 on the surface of the myeloma cells. And it's a drug that we are using in some cases in combination with our old friend lenalidomide or Revlimid, and using it in the setting of patients who may have been on lenalidomide and dexamethasone therapy and may have started to lose their response. I think that it is interesting to see how that drug is going to be combined later on with other drugs, and it's giving us more of a hint as to what's to come with these immune modulatory strategies.
Yeah, I guess it probably tried to bring the immune system to help attack myeloma cells. So that's another way of, sort of passive immunotherapy, but it has been shown to work. Any other questions from the audience? Back there.
Yes, could you describe some of the specific research projects and clinical trials now underway at IU?
Okay. You want to talk about? So let's see, Dr. Farag, you have a protocol for newly diagnosed patients that you're working on.